Hello and welcome to Good Life, the health show with me, Pooja. Well, viewers, diabetes, one of the fastest growing disease worldwide, has become a cause of concern for many who are increasingly leading a sedentary lifestyle with faulty eating habits and high levels of stress. Well, diabetes was earlier seen in the people above 40 years. It is now becoming common in all age groups, and even adolescents and young adults are at the greater risk of getting diabetes than before. So to discuss on this, we are being joined today by Dr. Pranab Pathak, consultant diabetologist from Nemcare Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for joining to Good Life, the health show today. And today the topic which we have taken is diabetes. And earlier we used to see that diabetes was usually seen in the age of 40 years, but nowadays it has been seen in adolescents, in young age, and also the age group is not certain. So at first, what would you like to start up with on the topic diabetes?
Now, there has been an increasing prevalence of diabetes even in the younger age group. The main reason behind this is because of lack of physical activity, sedentary lifestyle. Also, our food habits are not that good as it should be. We are taking too much of fast food, easy junk foods which is easily available, so this is consumed. And what is more important is that most of the people, they don't have proper food timing, and this is a very important reason which contributes to increased amount of weight gain, obesity, and there is also development of metabolic syndrome. This all culminates in development of diabetes at the younger age. Previously, it was seen that diabetes used to occur at a later stage, but now even young children also have got diabetes, right. And even young adults develop diabetes, especially they also develop obesity, and mainly the factor responsible is lack of physical activity and improper food eating pattern.
All right. Now, doctor, there is no certain fixed age these days for diabetes or holding up diabetes patients. Now, if we talk about, first of all, about pre-diabetic. Now, there are a lot of people who are pre-diabetic. So how these people can control themselves from getting to a major kind of disease? What do you have to say on that?
Yeah, those patients who are pre-diabetic, special focus and attention should be given to that category of people, because those are the kind of people, if we don't take care or if their sugars are not kept under good control, then in a very near future they will develop into full-blown diabetes. So my advice to those who are suffering from pre-diabetes is that you need to monitor your sugars more frequently, and at the same time you need to do regular physical activity and adhere to a healthy lifestyle. Take nutritious food, and preferably you should try to avoid junk food. Most importantly, stress is also a very important factor which is contributing to increased amount of pre-diabetes. So stress should be reduced by doing some relaxation techniques such as yoga, pranayam, and it's very important to control diabetes so that they don't develop into full-blown diabetes in near future.
All right. Now, doctor, let's talk about the common causes for increasing or the prevalence of diabetes in any of the person, be it children or be it an adult. So what do you have to say?
Since diabetes is a lifestyle disorder, most of the causes are attributed to unhealthy lifestyle. Of course, genetic component is there, we cannot deny that, since it runs in families. So especially those patients in whom there is a strong family history of diabetes, they should take proper care. But the other causes which are attributing to diabetes is lack of physical activity or improper food timing. Then there's a sedentary lifestyle. We are mostly doing less physical activity and doing more of mental work, or we are not following a routine protocol as regards food timing is concerned. So most of us do go out and take junk foods or easily available food. Right. So this is a very important cause which contributes to diabetes. Also, it is seen that a lot of obesity or increased weight also per se may lead to development of diabetes. So now age is no longer a criteria. It can happen to a person of any age,
Absolutely.
whether it is a one-day child or maybe an adult or an older age.
Now, there must be some kind of complications, doctor, as well. So what are the common complications if a person is suffering from a diabetes? What would be that?
Those patients who are suffering from diabetes, especially those who have uncontrolled diabetes and that too for a long period of time, may suffer from complications. They may suffer from microvascular or macrovascular complications where different organs of the body may be involved. Say for example, it may affect the eyes, they may have retinopathy, it may affect the nerves, they may develop neuropathy, then they may also develop some unhealing ulcers which leads to diabetic foot infection. Most importantly, patients who are suffering from uncontrolled diabetes are very likely to suffer from cardiovascular disease at one point of the other. They may suffer from any heart attack or say heart failure. So these are the common complications which arise because of uncontrolled diabetes. Not all patients who have diabetes they would develop these complications, but the complications per se are very common in those category of patients where the sugar remains uncontrolled for a long duration of time.
All right, now we would like to tell our viewers that our numbers are flashed on your television screens, and if you have any queries regarding the topic that is diabetes we have taken up today. So if you have any queries regarding diabetes, Dr. Pranab Pathak is with us at this entire episode. So you please call up, numbers are flashed on your television screen, call up and ask your question. Probably doctor will be able to give you all the answers. All right, doctor, coming back to you again, there must be an important role of diet and exercise in this entire episode to control a diabetes. Now, medicine play their role, but also we have to take a control of our diet. Also, we have to have a physical activity included in our lifestyle, isn't it?
Yes, that is very much true because the treatment management of diabetes usually involves lifestyle modification.
Okay.
Most of the patients can get their sugars under control by following a proper diet, and also physical activity is required, which needs to be done of course on a regular basis. What happens that sometimes patients do physical activity and then they skip out and they do not do it regularly, and this again culminates in development of diabetes or the complications may arise. So it is very much necessary that along with medications if required, you still need to follow a healthy diet, and at the same time you need to do your regular physical activity on a routine regular practice. So that is very, very important. And
Okay.
if the physician gives you any medication, whether it is tablet or insulin, then of course you should take it. But there is no excuse to diet and
Okay.
proper exercise. That has to be done.
That has to be done anyhow. All right, doctor, I would like to tell you ask you once again that there have been some of the patients, there I've seen that there are some patients, medicines were prescribed to them, but at point in time when they check their sugar level, if it comes down to normal, so what they do is they stop taking those medications. So at present, have you faced any these kind of problems, the patients who have come to you, or you are getting those kind of cases where the patient has stopped taking the medication? So what do you prescribe to them?
Yeah, we do get a lot of patients daily in our clinical practice and who usually stops the medication once their sugars are under control. They may think that yes, now that we have achieved a good target of our sugars, whether it is fasting or postprandial, then we can skip off the medication. But that is not the real picture. What is very important is that you need to continue medications, but yes, of course, certain modifications in the medication doses may be done. For that, of course, you need to consult your physician. You should not stop any medication without your doctor's advice. And you should consult your doctor regularly, because if there are any changes in the doses of the medication, the doctor can make the changes accordingly. But stopping a medication without consulting your doctor is not a wise option.
Absolutely. Now, doctor, during this COVID pandemic, was there an increase in diabetes patient? You must have got such cases as well.
Yes, we've been dealing with that problem for almost last 2 years. During this COVID, there has been a surge or an increase in the number of patients who are suffering from diabetes.
Okay.
Here I would like to say that diabetes, those patients who are suffering from diabetes, they are at increased risk of developing an infection. And since COVID is a viral infection, there is no exception to that. But what is important is that during this COVID time, especially those diabetic patients who have suffered from COVID, in them the sugars have become more, or we have got some new patients also who have been detected to have diabetes.
Okay.
The reason per se is because most of them have been put on steroids during the treatment of COVID. So steroid, as we all know, increases the blood sugar.
All right, doctor will come to that.
The patients
all right, doctor will come to that
yes.
discussion, but right now we have a caller, so let's take the call and then we'll proceed with the conversation. Hello.
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 Hello. Hi. Namaskar.
আমি শুনি আছো, আপনার প্রশ্নটো কৰিব।
Hi. মই এই ডায়েবেটিছ পেচেণ্টৰ বিষয়ে কিবা এটা কথা মই জানিব বিচাৰিছিলোঁ ছাৰৰ পৰা। মই জানিব বিচাৰিছিলোঁ যে যিটো আমাৰ ডায়েবেটিছ এজন মানুহৰে হওক বা আমাৰ নৰ্মেল অলপ জেনেৰেল মানুহৰ ক্ষেত্ৰতে হওক, তাত আমাৰ খোজ কঢ়াটো অলপ ভাল বুলি কয়। তো তেনেকুৱা তাৰ কিবা খোজ কঢ়াৰ টাইমিং থাকে নেকি? আমি কিমান সময় খোজ কাঢ়িলে বেছিকেলি আমাৰ শৰীৰৰ কাৰণে ভাল হয়, বা এজেড মানুহখিনিৰ কাৰণে কি ধৰণৰ খোজ কাঢ়িলে ভাল হয়, কাৰণ তেওঁলোকে বেছি খোজ কাঢ়িব নোৱাৰিব। তো তেনেকুৱা ধৰণৰ কিবা টাইমিং থাকে নেকি বিচাৰিছিলোঁ।
Okay.
খোজ কাঢ়াটো আমি সকলোকে উপদেশ দিওঁ যে খোজ কাঢ়িব লাগে। আমাৰ কিতাপৰ মতে লিখা থাকে যে 30 মিনিট সপ্তাহত এটলিষ্ট 5 দিন, মানে 150 মিনিট প্ৰতি সপ্তাহে এটলিষ্ট খোজ কাঢ়িব লাগে মিনিমাম। তাতকৈ অলপ বেছি খোজ কাঢ়িলেও ক্ষতি একো নকৰে। কিন্তু এটাই কথা এইখিনিতে ক'ব খোজোঁ যে যিসকল লোকৰ ধৰক আঁঠুৰ বিষ আছে বা আন কিছুমান অসুবিধা আছে যাৰ কাৰণে অলপ খোজ কঢ়াত অসুবিধা, গতিকে তেওঁলোকে বৰ বেছিও খোজ কাঢ়িব নালাগে, কিন্তু এটা নিয়মিতভাৱে খোজ কাঢ়িব লাগে। এনেকুৱা হ'ব নালাগে যে সপ্তাহৰ এদিনতে 150 মিনিট খোজ কাঢ়িলে বাকী 6 দিন খোজ কাঢ়া নাই, সেইটো কৰিব নালাগে। এটা নিয়মিতভাৱে ৰেগুলাৰলি এটা সময় বান্ধি ল'ব লাগে, আৰু সেইখিনি সময় খোজ কঢ়াটো উপকাৰী। কিন্তু এইখিনিতে এটা কথা ক'ব খোজোঁ যে যদি খোজকাঢ়িলে কিবা মানে অসুবিধা অনুভৱ কৰে, বা ধৰক বুকুৰ ধপধপনি হয় বা বুকুৰ বিষ হয় বা বুকুখন হেঁচা মাৰি ধৰে, তেতিয়া কিন্তু আপুনি নিজৰ চিকিৎসকৰ পৰা পৰামৰ্শ ল'ব লাগে। সেই হিচাপে আপোনাক চিকিৎসকে পৰামৰ্শ দিব যে আপুনি কিমান মিনিট খোজকাঢ়িব লাগে। কিন্তু এনেই জেনেৰেলি দেখা যায় যে 150 মিনিট প্ৰতি সপ্তাহে খোজকাঢ়াটো প্ৰয়োজন। হয়তো তাতকৈ অলপ বেছি খোজকাঢ়িলেও ক্ষতি একো নকৰে।
All right. Thank you so much for calling at this point in time. I'm sure you must be benefited with the answer just a doctor gave. All right, doctor, we'll come back to that conversation. But right now, we have to slip into a short break. So viewers will slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching A Good Life, the health show with me, Pooja, and we are having a fruitful discussion on diabetes with Dr. Pranab Pathak from Nemcare Hospital. Right, Dr. Pathak, we would like to ask you that during COVID pandemic, diabetes has taken an increase due to steroid, which you mentioned earlier to the break. So what are the other details you would like to mention at this point in time?
Steroid is one of the cause of increasing diabetes. The other important cause of increased incidence of diabetes during this COVID pandemic was because there was lockdown. Then patients, most of them were confined to their home. People who were hitting the gyms earlier were still not doing that. And also some patients were reluctant to do regular physical activity or go for morning walk. And this in turn has put an increase in the weight. And as we all know, weight gain or obesity also contributes to increased amount of sugars. Also, it has been seen that most of the patients, when they were in the home, then there was a tendency to eat more.
Okay.
This is called the snacking. So snacking was done more, and this also had caused increased amount of obesity and weight gain, and they've been taking sugars and this also has resulted in increased amount of diabetes. Also, it was seen that those patients in some, it's a theoretical thing that those patients were suffering from COVID infection. Maybe the virus has also affected the pancreatic beta cells, and there was also an increase in the incidence of COVID sugars during that COVID infection. But what is most common is the use of steroids, which contributed to increased incidence.
So a lot of possibilities to take an increase in diabetes, isn't it? All right, doctor, we have a caller at this point in time. Let's take the call. Hello.
Hello. Hi. Is steroid যেটা আমি ইউজ কৰো ডায়াবেটিকৰ কাৰণে উপায় নহলে যেটা steroidটো ইউজ কৰা হয় ই আমাৰ মানৱ শৰীৰৰ কাৰণে কিমানখিনি ক্ষতিকাৰক, আৰু এইটোৱে আমাৰ যেটো আমাৰ আয়ু ৰেখা সেইটো কমাব পাৰে নেকি?
ষ্টেৰইডটো ক্ষতিকাৰক বুলি ক'ব নোৱাৰি, কাৰণ ষ্টেৰইডটো যেতিয়া দিয়া হয় কোভিডৰ সময়ত বা যিকোনো ক্ষেত্ৰতে, তেতিয়া সেইটো এটা তাৰ ইণ্ডিকেশ্যন থাকে মানে ষ্টেৰইডটো প্ৰয়োজন হয় ষ্টেৰইডটো নিদিলেও ধৰক নহয় কিন্তু ষ্টেৰইডটোৰ এটাই যে ছাইড ইফেক্ট থাকে যে সি অলপ চুগাৰটো বঢ়াই দিয়ে সেই হিচাপে যিসকল লোকৰ ষ্টেৰইড দিয়াৰ কাৰণে চুগাৰটো বাঢ়ে তেওঁলোকে যদি ইনচুলিন লৈ আছে তেতিয়াহ'লে অলপ ইনচুলিনৰ ড'জটো সেই হিচাপে এডজাষ্ট কৰিবলগীয়া হয় ষ্টেৰইডে বিশেষ ক্ষতি একো নকৰে কিন্তু ষ্টেৰইডটো সেইটো সময় ধৰক নিদিলেও নহয় গতিকে ষ্টেৰইডটো দিয়া হয় তাৰ ছাইড ইফেক্টটো এটাই যে ই আমাৰ অলপ চুগাৰটো বঢ়াই দিয়ে আৰু ষ্টেৰইডটোতো খুব দীঘলীয়া সময়ৰ কাৰণে দিয়া নহয় এটা খন্তেকীয়া সময়ৰ কাৰণে ষ্টেৰইডটো দিয়া হয় ধৰক কেইদিনমানৰ কাৰণে সেই হিচাপে আমি চুগাৰৰ কাৰণে যিখিনি ঔষধ বা যিখিনি ইনচুলিন লৈ থাকে সেইখিনি ড'জখিনি অলপ সাল সলনি কৰিবলগীয়া হয় আৰু দেখা যায় যে যেতিয়া ষ্টেৰইডটো বন্ধ কৰি দিয়া হয় তেতিয়া ক্ৰমান্বয়ে চুগাৰখিনি কমি আহে সেই হিচাপে আমি আকৌ ইনচুলিন বা টেবলেটৰ ড'জবোৰ কমাই আনো গতিকে দেখা ষ্টেৰইড বন্ধ কৰাৰ কিছুদিনৰ পিছত আকৌ দেখা যায় যে চুগাৰটো ৰোগীজনৰ আগতে যেনেকুৱা নিয়ন্ত্ৰণত আছিল বা যিভাৱে আছিল সেইভাৱে নৰ্মেল ভাবলৈ গুচি আহে গতিকে ষ্টেৰইডে তেনেকুৱা ক্ষতি নকৰে কিন্তু সেইটো সময়ত ষ্টেৰইডটো প্ৰয়োজন সেই হিচাপে ষ্টেৰইডটো ব্যৱহাৰ কৰা হয় আৰু ষ্টেৰইড বন্ধ কৰাৰ পিছত কিন্তু চুগাৰটো আকৌ কমি আহে সেইবোৰ কিন্তু এইখিনিতে এটা কথা ক'ব লাগিব যে খোৱাখিনি মানে খাদ্য সেইখিনি নিয়মিতভাৱে খাব লাগিব আৰু শাৰীৰিক পৰিশ্ৰম যিখিনি পেচেণ্টে পাৰে যিখিনি তেওঁ নিজৰ দেহাই যিখিনি কৰিব দিব পাৰে সেইখিনি কিন্তু তেওঁ শাৰীৰিক পৰিশ্ৰম কৰি থাকিব লাগে আৰু লগতে কিন্তু সময়ে সময়ে ৰেষ্ট লোৱাটো বহুত দৰকাৰ বহুত ৰোগীসকলে কেতিয়াবা ৰেষ্ট নলয় ৰেষ্ট ইজ অলসো ভেৰি এসেনশিয়াল
Okay, all right. Thank you so much for calling at this point in time. Now, doctor, another problem which we have seen these days is obesity. Is that also related to diabetes? Because we have seen that during this pandemic period, lifestyle has changed of many. Be it student of a working person, they have to sit back at home as things have come down to working from home or the schools are closed. So students had to stay back at home. So physical activity has come to a standstill. Now, this has also led to obesity. Now, on that note, what do you have to say?
That is one area which we cannot help that very much because when there was lockdown or when now that most of them are doing work from home or the schools have been closed and they are doing online classes. So this is mainly contributing to increased obesity, especially now in the children, they're putting on more and more weight. So my advice to them is that, okay, that is a part of life, we need to do that, but at the same time we need to continue the physical activity. Even if you're not going out, even in your home or even in your compound, you should do some regular physical activity, whether it is walking or jumping or skipping or cycling. These are very good methods by which you can put a check on your weight, and it is also very equally important to avoid junk food, and you should have a proper timing of food. You should consult with your doctor regarding the total calorie intake, because what I have seen in the COVID time is that the calorie intake has increased quite a bit, and this calorie intake has contributed to increased obesity. So my advice will be that you consult your dietitian or your doctor. Take the required amount of calories which is permitted as per your body, and at the same time do whatever physical activity is possible in your home.
Absolutely. Now, doctor, if we talk about the treatment procedure for diabetes, now if it is a probiotic patient or if we talk about the pre-diabetic or a diabetes patient, medication is very important, and unless and until your doctor or your doctor have advised you to stop the medication, you shouldn't. Now, if we talk about the major treatment, if there is another treatment procedure, what would be that? What are the hospital facilities putting on this?
Sorry, can you just repeat the question?
My question was that we have seen that a lot of treatment procedures have come up, but simple medication is also given on this diabetes. Now, if we talk about the pre-diabetic, does they also need medication, or it has been okay with the diet process, they can reduce their diabetes procedure?
Most of our patients who are pre-diabetic will be able to do good with only physical activity and some amount of diet control. That is of course the main key to control the diabetes. They need to follow a judicious diet, they need to do regular physical activity, but sometimes it is seen that in some pre-diabetic patients, along with diet and regular amount of physical activity, some medications may be required, but this again depends on the patient. A routine investigation of the blood and the urine has to be done. If any other blood parameters or any other laboratory test needs to be done, that has to be done as per the advice of the physician. But what is equally important is that If the doctor suggests you some medicines, you should take, but you cannot skip your diet, and you cannot avoid. You should do a regular physical activity on a regular basis.
All right. Now, doctor, is there any common myth related to diabetes as well? There are a lot of talk of the town going on regarding the common myths that have been related to diabetes. What would be that, and what suggestions you would like to put on that?
Yeah, there are many common myths about diabetes patients have. First of the most commonest, I'll just discuss about the most commonest one regarding insulin.
Right.
Many of the patients have phobia for insulin, and many of the patients do think that if they are given insulin, then they have reached the penultimate stage of the disease. Or where they have reached a very critical stage of the disease, but it is not so. Sometimes even in newly detected diabetic patients, we may require to give insulin to some of the patients, and it is not that once you are on insulin, you cannot shift back to tablets. Most of the patients have the false belief that if you are using insulin once, then you have to continue for the rest of the time. This is not the real case, especially in type 2 diabetes. Type 1 diabetes, of course, is a different issue where you have to take insulin. But for type 2 diabetes, sometimes a short-acting insulin for a short duration of time may be helpful, and once the sugars are under control, then you can take off insulin. And one more myth is there, insulin is very painful. Most of the patients do think that, but now a lot of improvement have come, and a lot of new insulin pens have come which are very less painful and which are easy to carry, easy to handle, and that is why now this users of insulin has increased. Previously the users of insulin was not that much. Now of course the acceptance of insulin has increased, but what is very important is that you need to counsel the patient properly.
All right. Now, doctor, is there any is the treatment procedure common in both children and adults? So what would you like to say on that?
Regarding the treatment, what is important is that first you need to diagnose the type of diabetes, whether it is type 1 diabetes or type 2 diabetes. Type 1 diabetes is a condition where the body doesn't produce insulin or produces very little amount of insulin, and therefore for them the treatment of choice is insulin. But type 2 diabetes is a condition where there is either insulin deficiency or insulin resistance or a combination of both. So in those category of patients, you may start with tablets, but after a certain period of time the patient may require insulin, or sometimes the patient may require a combination of both insulin and tablets. So there is no specific age bar that beyond this age we will need insulin, or below this age we will need only tablets. It again depends on the person to person. So this is where precision diabetes will come into play, where the treatment of diabetes will vary from patient to patient. It cannot be generalized, and the doctor will take the decision as to what treatment is best for the patient.
All right, doctor, we are really short of time at this point in time. So what would be the suggestions from your part to our viewers who are watching our show at this point in time? How can they have a healthy lifestyle? Because a good lifestyle is a healthy lifestyle can decrease all the diseases. And if we are talking about diabetes, so this has become a part and parcel of everybody, be it adult or a children. There is no age bar seen nowadays for a diabetic patient, isn't it?
Yes, my advice to all the viewers here, that if you're suffering from diabetes, it is very important that first of all you should not panic. It's not the end of life. You can live a healthy, happy life even with diabetes. You need to make some changes in your diet. You need to follow a healthy, judicious diet. You need to do some regular physical activity. You need to consult your physician. And at the same time, if any medication is given to you by your physician, you should take it from time to time. Also, what is very important is now that there is a lot of stress among the patients, whether it is physical stress, mental stress, which really has an important cause of diabetes. And along with diabetes, patient may also suffer from other diseases such as hypertension or any cardiac issues. So those category of patients should consult their doctors more frequently. And even if your sugars are under control, you should not stop any medication without the advice of your physician. So my advice is that if you follow a healthy lifestyle, then definitely you can control your diabetes, and you should take your medications, and at the same time you also need to do regular physical activity.
Absolutely. So medication and diet and also physical activity should go side by side. Thank you so much, Doctor, for joining today to Good Life, the Health Show, and giving all those valuable advices to our viewers who have watched our show at this point in time. And viewers, with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.